Welcome to the ClearlyWell podcast. I'm Elizabeth McKeon, a board-certified psychiatric mental health and addiction recovery nurse. This podcast aims to bridge the gap between mental health and substance use discussions, fostering understanding and empathy while reducing stigma. Join us as we amplify the voices of those with lived experiences, creating a non-judgmental space for their stories to be heard. Thank you for tuning in. Hello, this is Elizabeth McKeon with the ClearlyWell podcast, and welcome to today's short sesh. Today we're going to talk about medication-assisted treatment. The acronym for that is MAT, M-A-T. The reason I chose to talk about this today is because I am finding that even in my own program and the area in which I live and treat, that there's just definitely a lot of misunderstanding about what it is. I serve on a board for drug court. Drug court, by the way, is a court-mandated way for folks who have been charged with substance use disorder issues to be able to get treatment and try to heal and do better in society and be released without incarceration. So anyway, I serve on an advisory board for that. And oftentimes what I find is when you bring a group of people together on an advisory board, you have all walks of life, and that's what an advisory board is for. But I found that there was definitely some folks on the board that didn't understand what medication-assisted treatment for substance use disorder involves. So I want to try to see if I can't address the stigma that goes along with that. And I think that where that might be coming from is there is a thing called a methadone clinic, which was the original medication-assisted treatment for substance use disorder and pain, actually intractable pain. And I want to say just right off the bat, I don't take a side on any particular type of medication-assisted treatment. They all have a place and a space. But today I just want to bring a little bit of understanding to what it is. So MAT, or medication-assisted treatment, involves using medications, but that is alongside with counseling and behavioral therapy to help folks manage and recover from substance use disorder of any type, particularly opioid use disorder. MAT has been shown through anything you can look up online, has been shown to reduce overdose rates, improve retention and treatment, improve and reduce recidivism to not only jail but emergency rooms, and decrease illicit drug use. However, with that said, it very much remains a very debated approach. So what I'm going to talk about today is the arguments in favor of MAT, and then on the other side, I'm going to look at why some folks oppose MAT. So the first thing I'm going to talk about is how effective it is in reducing relapse and overdose. Now, and I'm going to talk about this broadly in terms of all MAT, and then we're going to get into the types of MAT at the end right before I wrap up. So research shows that MAT can significantly reduce the likelihood of relapse and overdose with medications like methadone, buprenorphine, and naltrexone to help manage cravings and withdrawal symptoms. This improves the quality of life for those folks who are trying to regain control over their lives, work, and relationships by providing stability and reducing harmful effects of withdrawal and cravings. Better long-term outcomes. So that's important because it reduces risky behavior while improving treatment retention. And when I talk about risky behavior, I always harp on like the change brain. So in a person with substance use disorder, remember that the mesolimbic system, which is your decision-making tool, is turned off or down. And so with that comes risky behavior. Things like sharing needles, cheating, relapse, All of those things are going to happen while using. So with Matt, they're not using, they're gaining their brain back, and they're reducing those risky and harmful behaviors. They also have better long-term outcomes. So that's basically all the good reasons and the reasons that people are for medication-assisted treatment. Now, some of the reasons that people oppose MAT, and I hear this a lot, I'll have someone say to me like, oh, it's just putting a Band-Aid on it. So their concern is that they're replacing one addiction for another or for the same thing. What I'm going to say about that from a personal opinion, and I'm sure I'll get an email about it, is that like this. You're replacing one legal drug for an illegal drug. So there's that. It takes away the needle usage. So there's that. But these are prescribed and they're in controlled doses. And they also don't provide that euphoric effect that the illegal, dangerous, non-prescribed drug is giving that person. So also some individuals and even professionals believe that recovery should mean complete abstinence. Therefore, MAT is actually being seen as not true recovery. So that's another concern. There's another concern that MAT may focus too heavily on the medication and overlook the importance of counseling and behavioral therapy to include peer support. One thing that I will say is that the peer support and counseling piece has to be there 100% of the time, or it's not going to work. And then also some people oppose MAT because it can be challenging to access, and particularly in rural areas. And then it's extremely expensive, guys. I'm just going to tell you right now, I was at a training yesterday, and I can't ever expose the name of the drug that it was for, but I was at a pharmacological event yesterday. This drug that they were basically trying to get us to prescribe is $2,008 a month. So I think we know that that's not doable for the average person. So, that's just got to be addressed, and that's going to have to be on a legislative standpoint. And now I'm going to talk about the middle ground here. Many experts support a balanced approach, seeing MAT as one tool among many in treating substance use disorder. Integrating MAT with counseling, peer support, and addressing underlying issues such as, guess what, guys, mental health, can create a more comprehensive and lifelong sustaining recovery plan. While MAT is not a one-size-fits-all solution, it definitely does save lives, and it does get illicit drugs off the street. So, wrapping up, I do want to just address what are the types of medication-assisted treatment. So, the oldest and probably one of the ones that stands out to people negatively, and I want to try to help clear that up, is going to be methadone. That is a long-acting opioid agonist, which means it does have the full opioid effect. Methadone does help reduce cravings and withdrawal symptoms for individuals with opioid use disorder. And pain, I do want to address that, is very effective in pain management. It is usually administered in a clinical setting due to its strict federal regulations. And again, I'm not going to talk about brand names today, so I'm just talking about the drug itself. The next one is buprenorphine. This is a partial opioid agonist that reduces cravings and withdrawals without producing any high associated with opioids. So just think about this. If you had a cup of coffee and you put a piece of paper over the cup, that's kind of like how buprenorphine reacts within that opioid receptor. It has a little piece, like a little blocker over the top of the cup, so the drug cannot get in there and make you high. However, it does reduce the craving and withdrawal. Buprenorphine is available in various forms. It's sublingual, tablets, extended release, injectables, and can be prescribed in an office-based setting. Lastly, and one that I see used more commonly now today, is naltrexone. This is an opioid full antagonist. This completely blocks the effect. So instead of that piece of paper over the cup of coffee, think about a metal blockade. It has a piece of aluminum foil over the top of the cup so that nothing can get down inside that opioid receptor. This is also used for alcohol use disorder, and it reduces the rewarding effects of alcohol consumption as well as other drugs. Naltrexone does come in both oral and extended release injectables. In one of the programs I work in Jail Inreach, we use this for inmates leaving jail population to go into general population to help them not go out and overdose when they go back out and into the general population. And we find that we are reducing overdose rates and recidivism back to jail by 86%. Guys, that's huge. So I want to say that MAT belongs in our society, and everyone doesn't have to have the same opinion about it. But at the end of the day, we do know that it's helping save lives. It's helping get illicit drugs off our streets. And that's just really all I can say about it. It doesn't work for everyone, but it works in a large part of our population, and it's saving lives. So lastly, I just want to say that MAT should always be paired with behavioral therapy and peer support to address the physical and psychological components of addiction comprehensively. So that's how we'll wrap up today, guys. Just remember, I'm not a counselor. I'm a nurse, and while I specialize in this field, I don't have all the answers. So please be kind in your emails and your responses to what I've said today. This is completely informational, and just please know that. And if you need help, please reach out, guys, to a licensed professional counselor, doctor, or provider for help. Thank you for listening. I want to state that please do not substitute this podcast for professional therapy or treatment. The content shared here is for informational and entertainment purposes only. We do ask our listeners to respect the diverse experiences of individuals and refrain from passing judgment. If you or someone you know needs professional help, please seek the guidance of a registered and qualified mental health professional. ClearlyWell is brought to you by Healthy Georgia and produced by CNC Media.